Thank you ever so much for your cooperation in taking your seats, please. The high-level meeting of the General Assembly on the fight against tuberculosis is called to order. Heads of state and government, Deputy Secretary General of the United Nations, President of the Economic and Social Council, Director General of the World Health Organization, Excellencies, distinguished delegates, ladies and gentlemen. I warmly welcome all of you to this high-level meeting convened under the overall theme, Advancing Science, Finance, and Innovation and Their Benefits to urgently end the global tuberculosis epidemic, in particular by ensuring equitable access to prevention, testing, treatment, and care. Before proceeding further, and in accordance with General Assembly Resolution 77/274, I now invite the high-level meeting to turn its attention to the draft political declaration entitled Political Declaration of the United Nations General Assembly High-Level Meeting on the Fight Against Tuberculosis, Advancing Science, Finance, and Innovation, and Their Benefits to urgently end the global tuberculosis epidemic, in particular by ensuring equitable access to prevention, testing, treatment, and care, the text of which was transmitted to member states by the President of the General Assembly in a letter dated 1st September 2023. Pursuant to General Assembly Resolution 77/274, following the approval of the political declaration by this high-level meeting, I will submit it for the formal adoption by the General Assembly. May I take it that the high-level meeting approves the draft political declaration, which, pursuant to General Assembly Resolution 77/274, I will then submit to the formal consideration of the Assembly? I hear no objections. It is so decided. NTB. I congratulate all member states on their approval of this draft political declaration, which I will submit to the General Assembly for its formal adoption at a later date. Allow me to express my sincere appreciation to the co-facilitators of the negotiating process, His Excellency Krzysztof Szczyzewski, Permanent Representative of Poland to the United Nations, and His Excellency Bakior Ibragiminov, former Permanent Representative of Uzbekistan to the United Nations, for their skillful stewardship and dedicated hard work, which has brought us to this significant outcome. I also extend my sincere thanks to all member states for their flexibility and constructive engagement. Allow me now to make a statement as President of the General Assembly. Excellencies, distinguished guests, ladies and gentlemen, we come together today with a purpose, a resolve, a drive to reinvigorate commitments and accelerate progress towards ending tuberculosis. a millennia-old disease that is one of the world's top infectious killers. Why? After all the progress we have made, from sending man to the moon to bringing the world to our fingertips, have we been unable to defeat a preventable and curable disease that kills over 4,400 people a day? Excellencies, the TB epidemic thrives due to well-known inequities such as poverty and undernutrition, and it is further exacerbated by conflicts, climate change, and other crises. The COVID-19 pandemic reversed years of progress in the fight to end TB, placing an even heavier burden on those affected, especially the most vulnerable. Ending TB has proven to be unexpectedly tough. The gap in access to services across the care continuum is acute, while stigma and discrimination continue to compound vulnerability and hinder the public health response. Women in particular face severe effects. It has never been more important to reimagine the response to TB and tackle the root causes of the epidemic. Where do we start? Innovation is vital in this endeavor. Social science and health system research are key to improving the effectiveness, impact, and acceptability of TB care, along with a strong degree of social ownership. We also need affordable and more accurate, rapid point-of-care diagnostics, along with more efficient and non-toxic treatment regimes, particularly for drug-resistant TB. But to end TB as soon as possible, we need safe and effective vaccines. In this context, I welcome WHO's establishment of the TB Vaccine Accelerator Council, which will help us strengthen the search. Excellencies, until we find a vaccine, we must apply all of the tools at our disposal. Ensuring universal health coverage and advancing science and innovation will require all stakeholders to join forces. Adequate investment by the public sector is crucial if governments are to fulfill their obligations on the right to health. Public-private partnerships, engagement of academia and civil society, and funding from philanthropic sources are also essential. In addition, we need transparent, reliable, and widely available data to translate evidence into policy. Equitable access to benefits of research is also fundamental, with need prioritized above the ability to pay. With need prioritized above the ability to pay. Excellencies, today as we take stock of our efforts to end TB by 2030, I wish to reflect on what we have accomplished. Amid unprecedented global crises, over 74 million lives have been saved in the last 2 decades. This is thanks to your efforts as governments, civil society, academia, researchers, business, and donors. The political declaration just approved today reflects the importance of a whole-of-society, whole-of-government approach that makes evidence-based recommendations to end TB by 2030. But time is running out. I rely on you to inspire political commitments driven by science, equity, and inclusion. I encourage you to use today's platform to send a clear and united message. Together, up at the top, we can end TB.
He's a rebel, also.
Thank you very much.